Now in the front of the lumbar vertebrae is the most important muscle in terms of structure or posture, which is called the psoas muscle, connected with the inside of the pelvis, the muscle, the iliacus. The psoas and the iliacus both connect into the lesser trochanter of the femur here. They're the main hip flexors. And when the feet are on the ground, they rotate the pelvis forward like this, anterior, which you see in many people, this hyperlordosis. People like this, obvious setup for low back pain, back of the pelvis pain. Yeah, lack of support from the pelvis and legs for the lumbar, so then everything has to tighten. So we're going to work the psoas and a little bit the iliacus. Many of you who do deep body work already do this psoas work. But you feel for the anterior superior iliac spine, this protrusion or process right off the ilium in the front, easy to find. Then you slide over it towards the umbilicus, the belly button, with the opposite hand like this. I have my right foot forward and my right hand coming in, and then with the opposite hand I brace it, and I come in like this. Now what I'm going to ask her to do is lift her knee up, and that's flexion of the hip. I'll feel the muscle contract against my finger, which I did. Do it again, yeah, it contracts against my finger. So then I'll take it there. That lengthens the psoas as I stretch it and work it. As she straightens, push through your heel, push all the way through your heel. Good. Good. Yeah. And lengthen. And I can support it by lengthening through the leg. Okay, now I'm going to work the iliacus. Very important complex of muscle, two muscles on either side, the iliopsoas. This is the lower muscle that forms inside the pelvic, the ilium, and goes with a common tendon as the psoas to the lesser trochanter of the hip, right near the hip joint. So this can be the real culprit also in anterior tilt or forward tilt of the pelvis. Just with my fingers slowly come around and just start to feel the inside rim of the ilium. Is that okay? It's too much? 7 or?
Almost too much.
Almost.
More like it's like a tickly. Like
okay,
almost.
So this can be very sensitive or ticklish area. And you have to go very slow. Some people can't even be touched here, really. You have to go slow, and then I'm going to have Gopi again move her knee over her second toe like this. I'll raise her so you can see. Yeah, and she just gently moves it slowly and like that. Yeah, and that drops her pelvis back and stretches. Yeah, good. Oh, very good. I can stay on this for, as long as it's 30 seconds or so, just to give her time to release. And then I'll ask her to stop the movement and just drop her pelvis, her legs over towards her right side, and I'll stretch in and back up. Yeah. And over to the right again. Ooh, and I can feel the muscle contract and then stretch. And then up. Yeah.